The top stories tonight in Y News. The country again breaks its record for the highest single-day increase of COVID-19 cases today, with active cases nearing 100,000.
The Department of Education has approved the use of schools in the National Capital Region as COVID-19 isolation facilities.
President Rodrigo Duterte sees a gray area in the liability of mayors who defy the vaccination priority list. Passengers are stranded in the Manila port for 5 days.
India detects a new variant described as a double mutant.
And people from different walks of life receive free meals from the Members Church of God International amid the pandemic. Good evening, Philippines and the world. We are now reporting live from EDSA Centris in Quezon City. Today is Thursday, March 25, 2021. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Puto.
First in the news. The Philippines reported another 8,773 new COVID-19 cases nationwide, its biggest daily surge in infections since it was hit by the pandemic last year. The new cases breached the previous high of 8,019 last March 22. The Department of Health said that the new infections brought the total number of confirmed cases nationwide to 693,048. It noted that 14.4% of the overall tally, or 99,891, are active cases or those who are still ill. Of the active cases, the DOH said 95% exhibit mild symptoms, 3% are asymptomatic, 0.8% are critical and are severe condition, and 0.44% are moderate condition. The recovery count also rose to 580,062, with 574 more recoveries. Meanwhile, the death toll increased by 56 to 13,095. The Philippines is in the 30th spot among countries with the most number of COVID-19 cases based on the World Health Organization's COVID tally. The Department of Education has approved the use of several schools in the National Capital Region as COVID-19 isolation facilities as cases of COVID-19 continues to surge. But the Metropolitan Manila Development Authority, or MMDA, opts to use the classrooms once other isolation facilities are full. Asher Katapan Jr. tells us why.
The Department of Education has allowed its schools in the National Capital Region to be utilized as COVID-19 isolation facility, provided that there are no other facilities available for such purpose. Metropolitan Manila Development Authority Chairman Benjamin Benhur Abalos Jr. said that this is one of the conditions of DepEd in letting them use its facilities. The MMDA should also comply with the requirements in establishing an isolation facility based on the guidelines set by the Interagency Task Force on the Management of Emerging Infectious Diseases, or IATF, and the Department of Health. Other COVID-19 related activities are also prohibited within the school premises. Chairman Abalos, on the other hand, explains that the schools will only be used to isolate asymptomatic and mild symptomatic COVID-19 patients.
Dalawa yan, no? Isa yung tinatawag nating temporary, yung isolation talaga. Tapos yung isa naman, parang may mga sakit sila na medyo mild, may symptoms na parang semi-treatment facility.
Based on MMDA's data, Isolation facilities across Metro Manila are almost overwhelmed with COVID-19 patients, with 91% occupancy rate in hotels for positive asymptomatic patients and about 71% full in temporary treatment and monitoring facilities for positive mild symptomatic patients. Abalos further explains that the government will save a lot of fund in utilizing schools as isolation facilities instead of hotels.
Ang importante kasi sa atin, talaga mas asymptomatic, may isolate. Pero it will be very costly for us also kung puro hotels naman. That is why we're already requesting for the use of the school building. Para medyo una mas convenient sa mga tao dahil malapit lang yung sa lugar nila. No? Pangalawa, mas cheaper naman. Malaki matitipid ng gobyerno rito.
Meanwhile, the Department of Public Works and Highways has also been checking other facilities that they previously constructed in different cities and municipalities in the region if they can still be used as isolation facility. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, Malacanang renewed its call for mayors to stop receiving COVID-19 vaccines that are allotted for the healthcare workers. President Rodrigo Duterte, meanwhile, has admitted that there was a gray area in the mayor's liability. Rosalie Cos will tell us why.
The Philippines may lose the 44 million doses of COVID-19 vaccines from the World Health Organization-led COVAX facility. Malacanang reiterates this as it appeals again to mayors not to jump the vaccination lines. President Rodrigo Duterte has already named in public some mayors who jumped the line and he wants the Office of the Ombudsman to investigate.
Mga mayor, tama na po yan, ha? Pag yan ay nagpatuloy, 44 million ang dosages ng COVAX facility vaccines ang po pwedeng mawala sa atin. No? So please, we ask for your indulgence.
Most of the local chief executives who have been vaccinated said they received the shot to boost the vaccine confidence of their constituents. The chief executive said himself it is difficult to say whether this mayor should be held liable.
Ito yung ang rason nila, I think that is a universal excuse na para hindi matakot yung mga constituents. Well, ako medyo gray area yan. Na dapat talaga ang una yung mga whether or not they jump the COVID-19 line of vaccination would require a certain amount of illegal study.
Presidential spokesperson Harry Roque said though mayors have been reclassified to A4 in the COVID-19 vaccine priority list of the government, currently the inoculation is still with the A1 or the healthcare workers. Meanwhile, the palace says command responsibility is not applicable with the vaccination of some personnel of the Presidential Security Group or PSG in 2020.
Wala pong application ng command responsibility kung wala po tayong digmaan. Yan po ay umiira lang yung konsepto ng command responsibility kapag mayroong digmaan dahil meron po tayong batas na umiiral.
Some PSG personnel had been inoculated with unregistered Sinopharm vaccine and the issue became controversial. But in February, the Food and Drug Administration granted the PSG compassionate special permit for the use of 10,000 doses of Chinese Sinopharm vaccines. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
And the list of public servants receiving COVID-19 vaccines goes on. The Department of Interior and Local Government revealed that a counselor in Parañaque and an employee of the Department of Justice are facing investigation for defying the vaccination priority list. Joanne Nano reports why.
As the Department of Interior and Local Government focuses on the conduct of investigating the local government officials who reportedly jumped on the COVID-19 vaccine priority list, the agency found out that a city councilor from Parañaque City and an employee from the Department of Justice was also reported that have allegedly breached the vaccination priority list. With this, the DILG has sought the help of Parañaque City Mayor Edwin Olivares regarding the matter, as well as the reported inoculation of celebrity Mark Anthony Fernandez with an AstraZeneca vaccine. The UNTV news team is still trying to reach Mayor Olivares to ask for his comment on the issue. But yesterday in an interview, Mayor Olivares reiterates that Fernandez was qualified as a substitute for COVID-19 vaccination as he, according to them, belongs to the priority group because he has comorbidity and depression in the past. However, the DILG is seemingly not convinced with the explanation given by Mayor Olivares.
Una sa lahat, excuse na lang nila nung nalaman lumabas sa balita na nakapagpalusot sila ng isang non-priority individual, gumawa na silang rason. So, talagang hindi nila sinunod itong mga priority list. At pag sinabi natin priority list, pag hindi po available dapat yung mga babakunahan, yung substitution dapat nandun din sa mga priority individuals. Hindi sila dapat tumalon sa labas, no? Which is, in their case, AstraZeneca po yan, so napaka-sensitive sa atin yan dahil yan po ay bakuna na galing sa COVAX facility ng World Health Organization. So nagiging kaduda-duda tuloy dyan, either nagpalakasan o nagkabayaran.
The DILG is also not pleased with those local officials saying that they only get inoculated of COVID-19 vaccine in order to boost vaccine confidence among the health workers.
Mga excuse nila na gusto nilang maging influencer, bago pa man din dumating ang mga bakuna na pag-usapan na po yan sa IATF vaccination cluster, na hindi po ang mga local chief executives ang magiging influencer. In fact, ang magiging influencer po at kaya tumataas ang kumpiyansa sa pagpapakuna dahil mahigit kalahating milyong ng ating mga health workers ay nabakunahan na at konting-konti po ang side effects.
Public servants proven to have violated the vaccination priority list will face administrative cases according to the DILG that will be forwarded to the Office of the Ombudsman. Meanwhile, the agency also clarified that DILG Undersecretary Jonathan Malaya has already explained in Malacanang as to why he was vaccinated last March 2 despite President Duterte did not allow him to get inoculated. DILG says that Malacanang has decided on it and it was done out of good faith.
Sa pag-aakala na pinapayagan sila, nagpabakuna po. Yung pala ang pinayagan lang ni Pangulo ay si Secretary Galvez, Secretary Vince Dizon at Chairman Benhar Abalos. So isang pagkakamali po yan in good faith and tinanggap naman po yung kapalinuwagan na yan ng Malacanang.
Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
Around 100 travelers are stranded outside the North Port Passenger Terminal in Tondo, Manila, as they attempt to go home to their respective provinces. Some of the passengers have been waiting outside the port for 5 days. JP Nunez will tell us why.
The Manila North Port Harbor Management has reminded the public who wish to travel to the provinces, especially on the long holiday, to check the travel requirements of their destination. This after some travelers were barred to board a ship for lacking negative RT-PCR test results. Vicky Versosa and her husband are among the 100 passengers stranded outside the port. She is now appealing for help to complete their documents.
Kasi po wala kaming swab test na requirements. Yung kasi hinahanap dun sa Bacolod. Wala naman po kaming perang pang swab.
Some of the stranded passengers have been waiting outside the port for 5 days. The Philippine Ports Authority advises them to go back to their homes and wait for the quarantine restriction to ease. However, some of the travelers have nowhere to go to.
Kala ko makaalis na, ibininta na namin mga gamit, wala na may balikan doon. Wala may pambayad ng upa na. Layo pang binungunan, ubos-ubos namin ng pera, pati yung budget. Mga 5 araw na po. Pang-anim na bukas. Baka mamatay kami sa gutom, di sa COVID.
The PPA advises the passengers to communicate to their respective provinces or LGU before going to port and to complete their requirements first. PPA also stressed that they will strictly implement the IATF guidelines, which means they will inspect all the requirements needed by passengers before boarding the ships.
Yung mga papuntang Palawan, nire-require doon kasi ng provincial government ng Palawan dapat mga apor lang dapat. ang papasakayin at papababain. Yung Region 6 naman, yung mga papunta sa probinsya sa Region 6, nagkaroon sila ngayon ng moratorium, so hindi muna sila tatanggap ng mga inbound passengers. At yun naman papunta sa Zamboanga, nire-require na ng sa LGU Zamboanga na dapat yung mga dadating doon ay merong negative PCR result.
JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
A new international review found that some rapid antigen COVID-19 tests meet World Health Organization's minimum acceptable standards. However, it was also found that rapid antigen tests are not reliable in asymptomatic COVID-19 cases. Ia De Vera gives us the details why live. Yes, Ia.
Jago, the independent research group in Cochrane, in collaboration with researchers and health professionals from 130 countries, has conducted an international review on different rapid COVID-19 antigen tests and found that few of them satisfied the minimum performance criteria of the World Health Organization. Based on the review, it was found that antigen tests are 78% accurate in the first week after COVID-19 symptoms were developed. Overall, rapid antigen tests correctly identified COVID-19 infection in an average of 72% when used to people who are symptomatic. Based on World Health Organization's minimum standard of at least 80% for people with COVID-19 symptoms, 2 antigen tests are identified as rapid tests with most accurate reviews. SD Biosensor's Standard Q has 88% accuracy, while Abbott PanBio has 75% accuracy. Also, for people who did not have COVID-19, antigen tests correctly identified negative results with 99% accuracy in people who have COVID-like symptoms or without symptoms at all. However, the reviewers found that when antigen tests are used to people without COVID-19 symptoms, the accuracy is lower with only 58%. Meanwhile, for molecular tests, including PCR, the researchers found that 95.1% of infections are correctly diagnosed and 99% are identified as negative diagnosis. But the researchers noted that there are no sufficient data to evaluate, as the studies did not provide enough information about the participants. Jago?
Thank you, Ia De Vera, reporting live.
For those watching our 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. As the country enters its second year of fighting the pandemic, lawmakers are pushing for new stimulus packages to help the affected sectors and revive the economy. Meanwhile, the palace supports the recommendation of expanding the financial aid to poor households amid stricter quarantine restrictions. Harleen Delgado will tell us why.
It has been exactly a year since President Duterte signed the first Bayanihan law to address the need for COVID-19 response. With the current rising of cases and tighter quarantine protocols, some lawmakers are pushing for a new stimulus package to help the most affected sectors and families. Yesterday, Senator Manny Pacquiao filed Senate Bill 2123, or the expanded stimulus bill worth 335 billion pesos. The proposed measure aims to provide 300 billion pesos for financial aid for low-income households, work subsidies, and capacity building to critically hit sectors, 30 billion pesos for assistance to displaced workers, and 5 billion pesos for internet allowances of teachers and students. Meanwhile, House Speaker Lord Alan Velasco is making a fresh push for the proposed third Bayanihan law named Bayanihan to Arise as One Act with 420 billion peso funding. The multi-billion stimulus package also aims to provide assistance to various sectors, including financial aid to households, funding for COVID-19 treatment and vaccines, and rehabilitation of typhoon-hit areas. Under the measure, each household member will receive 1,000 pesos regardless of their economic status, while 1,000 pesos allowance will also be given to each student and teacher, and 8,000 pesos for every displaced worker. Velasco said Finance Secretary Carlos Dominguez assured to him that efforts are being done to identify funding for the proposed Bayanihan 3. Meanwhile, Senator Bongo is urging the Executive Department to provide an expanded Social Amelioration Program or SAP to poor Filipinos whose lives are affected by stricter quarantine restrictions. The palace supports this but clarified that the allocated funds for the emergency subsidies under the Bayanihan 2 law and the 2021 national budget should be first disbursed and distributed to beneficiaries.
Ang kinakailangan po munang gawin ay unang-una siguraduhin ng mga pondo na linaan para sa subsidies sa ilalim ng Bayanihan 2 ay mapadistribute na sa kanilang mga beneficiaries. Bukod pa rito, meron tayong mga 287 billion worth of subsidies sa 2021 budget. Kung hindi po sapat yung nasa Bayanihan 2 at saka nasa 2021 budget, pwede naman po pag-usapan ang Bayanihan 3.
The Department of Budget and Management told UNTV News that it is still preparing its updated data on the status of fund releases to concerned government agencies. In January, President Duterte signed into law proposed bills extending the validity of the remaining funds from Bayanihan 2 until June 30, 2021 and the 2020 national budget until the end of the year. Jorlene Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Manila City Mayor Francisco Isko Moreno Domagoso signed an executive order authorizing heads of barangays to declare a lockdown in their areas subject to certain conditions. Under Executive Order Number 12, Domagoso said that barangay officials could declare a lockdown in their respective areas of authority given that the number of COVID-19 cases are 10 or more. The order states that within 3 hours from its issuance, the order placing the barangay or portion thereof under critical zone containment shall be forwarded to the city mayor for his confirmation. The Manila Health Department shall likewise verify the existence of COVID-19 active cases before the barangay could start its lockdown. All residents under the barangays to be placed under lockdown shall be strictly confined to their residences and are prohibited from going outside their homes.
An expert says COVID-19 vaccine should be offered to pregnant women and breastfeeding mothers. Aiko Miguel explains why.
One question often asked to experts on COVID-19 vaccines, is it safe to give it to breastfeeding mothers? According to Dr. Mian Silvestre from Kalusugan ng Mag-ina and Asia Pacific Center for Evidence-Based Healthcare and member of the Health Professional Alliance Against COVID-19 or HPAC, based on studies, all COVID-19 vaccines can be given to breastfeeding mother after consulting their physicians. The Philippine Pediatric Society supports the vaccination of breastfeeding women and even pregnant women.
We have guidelines na all, ganun din for pregnant and lactating. Why? No? Why blanket? No? Na all can be? Because the vaccines do not contain the live virus. No? All of the vaccines, kahit iba-iba sila, no? Sinovac, AstraZeneca, Pfizer, Moderna, all of them, what are there are particles. No? Either inactivated virus particles sa Sinovac or modified particles sa AZ, no, AstraZeneca. There is no COVID vaccine that contains live viruses that can replicate or multiply.
There are no data yet on how many healthcare workers who are also breastfeeding mothers that were vaccinated. But according to Dr. Silvestre's presentation, they have interviewed some inoculated breastfeeding mothers. One of them experienced mild adverse events like fever, body pain, and fatigue because of the vaccine, but she developed antibodies against COVID-19.
She was reassured because I told her yung fever, malamang senyales yan na lumalaban ang katawan niya. Because fever is a sign that her white blood cell soldiers are fighting off an infection. No? So she continued to breastfeed her infant.
There are also evidences based on studies in laboratories that mothers developed antibodies and can pass it onto their babies through their milk. The expert debunks that COVID-19 positive mothers can transmit the virus through breastfeeding. She encourages mothers not to stop giving their child the golden milk.
The longer and the more frequent you breastfeed, the better. So no timing to the vaccination na i-postpone mo. When you're offered it, get it.
Dr. Silvestre advises pediatricians to clearly explain the importance of inoculation to mothers.
It's still a personal, but make it a shared decision. Talk to your pedia. It's beneficial for you. It will protect you, from developing symptoms and dying. For our pediatricians, help your mothers make that decision more comfortably, Hindi yung bahala ka.
The Department of Health and the government emphasize that COVID-19 vaccination is not mandatory, but those who are often exposed to COVID-19 patients and those who belong to the vulnerable sector are encouraged to get protection against the virus through vaccination. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
With quarantine facilities in Metro Manila getting fully occupied, the Navotas City local government will allow asymptomatic COVID-19 patients to stay at home. But there's a catch. The patient must wear a tracking band. Janice Inhente will tell us why.
Several nations are using wristbands to track people during the coronavirus pandemic. These wristbands can record the movement of a person wearing it using GPS satellite location data. In Navotas City, asymptomatic COVID-19 patients will soon be using these electronic devices. The patients will undergo quarantine in their homes while wearing the device.
Nandiyan po yung Q-band ID, yung pangalan po ng pasyente, at yung kanyang location. Nakadesign po yung programa ng isang pasyente na may suot nito ay merong specific location at meron lamang po siyang pwedeng galawan, which is yung kanyang loob ng bahay.
When patients under quarantine exceed the 25-meter radius limit around their home, authorities can automatically see it on their tracker map.
Twice or 3 times a day, kailangan hong ipascan para masiguro ho namin na kayo hindi umalis ng bahay. Hindi ho ito specific ang oras. Para ho masiguro namin na hindi kayo pumunta ng bahay. At once na mag-scan ho kayo, papasok po dito yon sa aming system na i-scan nyo yung inyong Q-band.
The rules is the patient is not allowed to remove the Q-band and only City Health Office personnel are permitted to make modifications. Those who violate this will be fined up to 5,000 pesos. The Q-band system is expected to be implemented next week. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Bureau of Immigration created a fact-finding committee to investigate the human trafficking case involving a handful of the agency's immigration officers. The Bureau also added precautionary measures to monitor and prevent recurrence of irregularities. Marvin Calas explains why.
The Bureau of Immigration assured that all involved immigration officers on the controversial human trafficking of 44 women in Syria will be held liable. The department had created a dedicated fact-finding body that serves as intensive internal investigators on the involved personnel.
Sa fact-finding committee po, this is internal, ito po ay sa Bureau of Immigration. Ang resulta po nito ay pino-forward po namin sa Department of Justice, which is our mother department. Ito po yung may administrative powers over immigration. So doon po gugulong yung administrative cases laban po doon sa makita natin na talagang involved sa mga ganitong kalokohan.
Meanwhile, the Department of Justice and the National Bureau of Investigation will also take part in aid of investigating other airline personnel and illegal agents involved in the said anomaly. Avoiding the same incident, the department further intensifies security, such as reshuffling its department heads, terminal rotation, as well as rescheduling shifts. updating the 81-year-old immigration law and adjustments on the agency's organizational structure, hence having a third unit in monitoring operations of immigration port personnel will also take part.
Kasi yung bagong batas po natin, ito po ay sasagot sa napakaraming problema ng Bureau. And most importantly, bibigyan po niya yung head ng agency ng isang disciplinary mechanism para ma-actionan kaagad yung mga reports po of irregularities sa Bureau. Kasi sa current setup po natin ngayon, wala pong kapangyarihan ng Commissioner to implement immediately sanctions sa mga tao niya.
To receive real-time reports, comments, and suggestions from the public, a quick response feedback system was also implemented by the Bureau of Immigration. Marvin Calas, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine National Police has assured local government units of transparency in police operations following the shooting incident that killed Calbayog City Mayor Ronaldo Aquino and his aides. During a dialogue with the League of Cities of the Philippines, PNP officer in charge, Police Lieutenant General Guillermo Eleazar, underscored the importance of the partnership with LGUs as the PNP sought wider areas of cooperation and coordination between the two parties. The dialogue, initiated by LCP President Bacolod City Mayor Evelio Leonardia, was conducted to primarily express its condemnation over the death of Aquino and to secure assurance from the PNP that it will enforce measures to prevent similar situations. Eleazar welcomed the dialogue to restore the confidence of the local government executives in their police force amid the public reaction surrounding the Calbayog shooting incident. Aquino and 5 others, including 3 policemen, were killed in the shooting incident that took place on March 8.
And for the news abroad, who says traffic jams are just for roads? In Egypt's Suez Canal, a cargo container ship that is among the largest in the world is now causing traffic, threatening to disrupt a global shipping system already strained by the coronavirus pandemic. Marva Delfin will give us the details live. Yes, Marvi, good evening.
Mariel, tugboats and diggers are working in an operation to refloat the 400-meter-long and 59-meter-wide container ship named Ever Given, wedged diagonally across Egypt's Suez Canal, which could take at least 2 days, according to Egyptian officials. However, recent satellite images show the ship was still in the same position, with its bow touching the canal's eastern wall, while its stern appeared lodged against its western wall. The mega vessel, weighing 224,000 tons, is run by Taiwan-based freight company Evergreen Marine Corporation and is registered in Panama. It became stranded on Tuesday after losing the ability to steer amid high winds and a sandstorm which hit the region. And experts reckon nothing like this has ever happened in the 150-year history of the man-made waterway. There are now at least 100 ships blocked from entering the narrow shipping channel, which divides continental Africa from the Sinai Peninsula in northern Egypt. Even if the vessel is refloated quickly, the ship's Japanese owner and its insurers can face millions of dollars in claims from the Suez Canal Authority and other affected shipping companies for disruption and loss of revenue. Marielle?
All right, Marvi, thank you for that live report. India's surging COVID-19 cases allow scientists to identify a new mutation of coronavirus unique to the country. Early Briones will tell us the details live.
Marielle, as COVID-19 cases and daily death toll count relentlessly surge across India, health authorities recently discovered a new coronavirus variant that can potentially be more troublesome. The Indian SARS-CoV-2 Consortium on Genomics state that genetic variants of viruses are a natural occurrence. However, through genomic sequencing, they have identified a new variant that does not match any of the previously identified variants. This variant is currently described as a double mutant, and although it is not a scientific term, epidemiologists confirm that it is an entirely new mutation that contains characteristics of 2 other variants, one which is completely unique to India. The double mutant has been identified in more than 200 samples in the western state of Maharashtra, which is the hardest hit western state, and India's financial capital of Mumbai. Health officials, however, state that these detections are not large enough to link it to the recent rise in infection rates within the state. There is also no evidence yet to confirm that the mutant is more transmissible or even deadlier than those found earlier. On Wednesday, India recorded a record high of 47,262 new cases, taking the total tally to more than 11 million overall, and is now a seventh highest number of active cases globally. The death toll has now increased to more than 160,000 deaths. Meanwhile, the government has now opened the largest vaccination drive to boost nationwide vaccination coverage in fear of the rising death tolls and infection rates. The program is set to cover all eligible people of 45 years and above from the 1st of April. The rest of the population will be considered once the first set has been completed. India currently places third worldwide in terms of total number of COVID-19 vaccinations. Marielle?
Thank you for that update, Early Briones. Brazil's new health minister pledged a COVID-19 vaccination goal of 1 million shots per day. This report will tell us why.
Brazil's newly appointed health minister Marcelo Queiroga pledged on Wednesday a COVID-19 vaccination goal of 1 million doses as the number of COVID-19 deaths escalates in the country. It has now reached its worst death toll on Tuesday with 3,251 deaths, the highest fatality recorded in the country since the pandemic started last year. Brazil has now the second highest coronavirus death toll, next after the United States. The new health minister is aiming to accelerate the inoculation drive and believes that vaccinations, masks, and social distancing are all keys to slowing the virus. Moreover, Brazil's President Jair Bolsonaro stated on Wednesday that the government would seek more coordination with the state governors with weekly meetings to discuss coronavirus fighting measures in the newly launched committee. According to a Fiocruz survey, only 2.6% of the Brazilian adults have received 2 vaccine doses, while 7.6% of the population, or 12.1 million people, have received 1 shot. The World Health Organization have expressed alarm that the virus is surging dangerously across Brazil and urge all Brazilians to adopt preventive measures to stop the spread. Brazil is now more than 12 million COVID-19 cases to date and nearly 300,000 deaths according to a tally by Johns Hopkins University. Marielle Latoza, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Marielle Latoza, live from Perth, Australia. Good evening.
The Members Church of God International, or MCGI, has successfully launched today its global feeding program. Among the beneficiaries were residents in Quezon City who are still under lockdown. Dante Amento tells us why, live. Dante?
Yes, Diego, according to the latest tally, almost 75,000 individuals benefited from Members Church of God International's Global Feeding Program launched today. MCGI held the feeding program in 761 areas around the globe. There were house-to-house deliveries in some 500 local locations where mass gatherings could not be held, while there were 200 fixed venues. Throughout the duration of the program, health protocols were strictly observed to make sure that the event would not turn into a super spreader and will be safe for both the organizers and the beneficiaries. In Quezon City, some of the beneficiaries of the program were residents and hardware workers who are under lockdown in Barangay Balingasa. Even their barangay chairwoman is also on self-quarantine after she was exposed to a COVID-19 positive.
So lubos po ang aming pasasalamat sa piniabot niyong tulong para po lalong-lalo na po dun sa aming mga constituents na naka-lockdown sa ngayon.
The barangay officials hope that other groups or organizations would follow the example of MCGI.
Also encouraging other organizations para sa ginagawa po ng kagaya ng ginagawa ng MCGI na tularan at isang napakalaking privilege po na ang barangay po namin mabigyan ng ganito pong inyong programa.
Diego, last week, MCGI has also successfully launched its global free store to provide the needs of our fellow men who are most affected by the onslaught of the COVID-19 pandemic. And that's the latest live. Back to you, Diego.
Thank you, Dante Amento.
Meanwhile, the government supports and lauds private companies, groups, and individuals extending their help to our fellow men who are in need during these trying times, like what the Members Church of God International are undertaking. Ray Pelayo will tell us why live. Yes, Ray, go ahead.
Good evening, Will. Barangay Katipunan in Quezon City is one of the areas in Metro Manila that has recorded a high number of COVID-19 cases. Their movements have been restricted on and off for a year now, which affects their livelihoods.
COVID-19, ang banta ng paggutom talaga ang talagang pumapatay din sa iba natin mga kababayan dahil naririnig natin sa mga balita na ligtas nga sila pero wala naman silang source of income, hindi sila makapaghanap buhay para maitawid nila yung mga pang-araw-araw nilang pangangailangan sa kanilang pamilya.
This is why the Members Church of God International in Quezon City have chosen our indigent fellow men in this area to be the beneficiaries of their feeding program.
Ang laki po ng paghihirap na nangyayari ngayon sa nangyari na sa atin na pandemic ngayon. Sobra pong hirap ng kalagayan po namin.
Ang anak ko pong dalawa, isa walang trabaho.
An official of the United Nations World Food Program estimated in 2020 that around 270 million people will march towards starvation due to the pandemic. This is triple in the number of the Philippines population. DSWD NCR Director Vicente Tomas recognized the project of MCGI that augments the government's effort to serve Filipinos.
Instructions na to ng ating mahal na Pangulo na katuwang ang ibang mga partner agencies na talagang mag-reach out. Kaya nga kami ay nagpapasalamat dahil in spite of the risk, nandiyan po kayo, tumutulong sa amin.
During the distribution of free meals, health protocols were strictly observed.
Isa ito sa masasabi ko talaga na organized, well-planned, at syempre with God's grace talagang ang ganda. 150 beneficiaries ang nakinabang sa mga kabarangay ko dito at maraming salamat sa bumubuo ng Members Church of God International.
Brother Danny Navales, representative of the MCGI, said that the feeding program will continue to reach out to more people that are in need.
Ang atin pong buhay ay hindi naman natin dapat na sa sarili lang natin iuukol, kundi dapat din nating alalahanin yung kautusan ng Panginoon na meron tayong kapwa-taong dapat lingapin, dapat tulungan kung nangangailangan.
Will?
Yes, thank you very much, Ray Pelayo reporting live. More than 500 indigents and indigenous people in Davao City. Some of them were Magkikasalug tribe, where the government supplemental feeding program has been discontinued. Marisol Montaño will tell us why live. Yes, Marisol, go ahead.
Good evening, William. We are here in Marilog. Just check one of the far-flung areas in Davao City where the Members Church of God International conducted their feeding program launched globally today. Our indigenous recipients belong to the Matigsalog tribe of Davao City. Before the pandemic began, there was a supplemental feeding program conducted by the local government in the daycare centers. But because of the current situation, it was discontinued. Now, the local government and the DSWD say the MCGI's program is very timely. According to the DSWD, not all native families here can afford to have 3 meals a day. But today, they were able to taste chicken porridge, sausage and fried chicken, as well as pork chop, which they rarely eat. 250 recipients in Marilog district received food and water from MCGI. Most of the recipients are farmers who shared that their livelihood was affected by the pandemic. MCGI also distributed food packs to our needy fellow men in other parts of Davao like Buhangin, Maa, Ponciano, and Matina. MCGI members went around the streets of Davao City to give away food and water to the street children and indigents. In total, 540 indigent and indigenous people in Davao City received food packs from MCGI. And that's the latest here. Back to you, William.
Yes, thank you very much, Marisol Montaño, reporting live.
The Members Church of God International in Africa joined today's global launch of the MCGI feeding program. The Africans expressed their thanks for the help they received in these trying times. Rico Rivadenera will tell us why live. Yes, Rico?
Yes, Arlene, many Africans are suffering from the lack of permanent job, while some have work, but the payment is below average. Still, unable to make ends meet sufficiently. That is why they are thankful for the Members Church of God International's feeding program. For them, this project of the MCGI is a huge help, especially during these trying times. MCGI launched the feeding program in 11 countries across the continent of Africa. Among the beneficiaries were patients from hospital in Mozambique, garbage collectors, beggars, and construction workers in Burundi and Nigeria, homeless and persons with disabilities in Guinea, and some workers in Djibouti, and indigents in Ghana, Liberia, Angola, Tanzania, Ethiopia, and Algeria. They were given a sumptuous meal, which includes pasta and bread, beef with vegetables and rice, pork or chicken with rice, and a lot more. As of this time, MCGI has provided meals for almost 500 individuals in some countries in Africa during its feeding program. And that's the latest in Africa. Back to you, Harleen.
Thank you, Rico, for that report. And those are the reasons behind the news, March 25, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people, we give glory to God.